Okay. Dear doctors, first of all, I'm very happy to see you, and I'm also proud to stay here. And today, in our symposium, in our SUISSELLE Cell Booster Symposium, we want to talk not only about the product, but about the modern aesthetics today, because it's evolving, and you will see different trends. And let me start about the company. And I think it's a quite unique company because it's located in Switzerland, and within our location we have research and development, and we have also manufacturing facility. Why it's important? Because based on that we can provide doctors with a high effective product, and as well with a safe product, with a Swiss quality, and that's something very important. And here you can see our top-selling product, and this is a cell boosters. Cell boosters, this is an injectable medical class 3. It's a sterilized product, and the products created based on the CHAC technology. Later, I will explain you what means CHAC technology, but I think it's very uniqueness feature of the product. And you can see here, this is the portfolio it's anti-aging portfolio, but we have different 4 products that can target different sides of aging. For example, Lift, the first product, and you can see the composition also the different. The common composition, this is a hyaluronic acid, high-weight hyaluronic acid, together with vitamin C. But then you can see amino acids, you can see vitamins, and you can see trace elements, and that can vary. And these products can target different patient needs. For example, Lift, it's more for the lifting effect. Then we have Glow for depigmentation. Then we have a Hair for the hair loss, and Shape for the patients with the localized fat accumulation. And for example, for the Shape, it could be used as solo or together with the GLP treatment. So it's a different portfolio. So that portfolio can cover different patient needs. And we are fastly growing. Now we are covering more than 40 countries. And we're expanding our distribution. Of course, it's very good from commercial side, but as well, it's giving us a great insight of understanding better the needs and the trends of aesthetic industry, and understanding that the world is different. In Asia, you have this type of aging. For example, in Europe, you have this type of skin. And we are developing more and more protocols. We are developing and sponsoring a lot of the studies and the patient cases to share with the world. And honestly speaking, the aesthetic need is changing. If I saw some years ago, it was more about the correction. It was more about the feeling, and now it's more about the natural aging. How we can provide the better skin quality, how we can provide more natural aging. And also what I heard, very interesting insight from the doctors, it's not also about the injection. It's about the experience of the doctor together with the patient. It's becoming more marathon rather than sprint. Doctors are not planning to do everything in one session. They are planning like 1 year treatment plan, and it's becoming very smart. And also I heard a very interesting idea that now doctors are thinking what should be the first aesthetic experience of the patient to let the patients be confident and will to come again to aesthetic procedure. That's a lot of, not just, the products. It's more about the relationship between the patient and the doctor. And that's becoming very important. And where our product can fit very well. The most core important, and I think uniqueness of our product, and that I personally very impressed of. That's about the vision, how we think about hyaluronic acid. So hyaluronic acid is not, for us, is a just hydrating element. But we are looking for the hyaluronic acid as a potential, let's say, transportational platform into the cell. Because a lot of processes like collagen synthesis, melanogenesis, or fat metabolism is happening within the cell. So we need to deliver vitamins, amino acids, or minerals within the cell. And Chuck technology, this is an opportunity to conjugate HA together with the vitamins, minerals, and amino acids, and let them go into the cell. So here you can see the process, how it looks like, the endocytose of the hyaluronic acid together with components. So the main conclusion, we are providing a long-lasting effect and intracellular delivery, like a co-delivery of HA together with the K elements into the cell. And that's the crucial point of the technology. And we have a histological study that shows the presence of the product more than 2 weeks within the tissue. So you can see the product there. Usually, native HA can stay not longer than 72 hours. So we, with this complex, we are more defending the HA from destructing from hyaluronic DASA, so we are staying more longer. So we have longer stay plus intracellular delivery. And what's important, we are not cross-linked. So this is a special conjugation active elements together with the HA, but we're not cross-linked. So that's very important. So we are having the connection of the elements together with the hyaluronic acid. And we have clinical studies, which we published in scientific papers. And before coming to the scientific part of the symposium, I want to share one inspirational video with you about the product mission. Okay, I think it's sound. No, I was not checking sound, sorry. Okay, what's I can tell. I mean, so it's talking that patients are different, but usually, and if you can see, I mean, the skin require the similar thing, and what we can deliver, we can satisfy these patients with our product range. And now, let me come back to the scientific symposium, and for us again, we are not talking about the product. But what's the most important, we're talking right now about the patients, about their needs, and how we can support with our product and with our great opinion leaders, with our speakers. And today we have 3 great speakers, Dr. Ehrlich, Dr. Fruit, and Dr. Jenny, who will share their personal experience about the product, about the science, about the protocols, about the expectation and the results of their treatment using our product. And as well, I think it's very important to say that we also incorporated the information about the combination of treatment, because that's becoming also very popular, because doctors are not sitting alone just with one product. They have a different arsenal of different products or energy-based devices, which I can see a lot here. And then it's idea how you can combine this as well. So now I would like to give the floor to the Dr. Ehrlich to open the scientific part. And thank you so very much for coming.
Thank you very much.
It's mine.
Okay. Good morning, colleagues. I'm really happy to be here, and I really appreciate you being here that early. I would like to start by thanking the SUISSELLE team and, of course, Alexei for the introduction. You did all of our jobs, so we don't have anything to cover. But, no, I'm joking. We have a lot to cover today, because today we are speaking about science about extracellular matrix aging, extracellular matrix optimization, how can we integrate CHAC technology and cell booster in our clinical practice in order to amplify our outcome, increase our result, making better change, making healthier skin. And we'll do it in 5 different parts. I will start speaking about extracellular matrix aging, the CHAC technology, and the cell booster portfolio. And then my colleagues, Dr. Jenny and Dr. Fruit, will present to you their experience with cell booster glow and shape in redefining the facial texture, pigmentation, shape, and contour. So it will be interesting. It will be modulated. And if you have any question, please keep them to the end. We will do a Q&A where you can speak, where you can ask all the speakers for some questions. So this is my disclaimers. My name is Guy. I'm a medical doctor. I practice aesthetic medicine. I have 2 master degrees, one in aesthetic medicine, one in clinical dermatology. I work in various scenarios. I work in the plastic surgery department in one hospital, genetic institute in a second hospital, governmental organization, private clinics. I work in many scenarios. I see many patients. And I agree that all patients have something in similar. And we'll see now how skin age, what happened in the extracellular matrix, and how extracellular matrix environment affect cellular aging. So this is my disclaimer. I'm international trainer for SUISSELLE, but also for Cynosure, Anti-Age, Novoxel, Galderma, and Selenis, but this is a sponsor session. So, intrinsic aging, unpreventable, right? We cannot prevent chronological aging. Every year passing, we become older, our skin cells become older. We cannot prevent it. But extrinsic photodamage, we can, right? We can put sunscreen, we can try to not be exposed to sun, and thereby decrease aging probability, because photodamage, extrinsic photoaging, has a more important role in skin damage than the intrinsic aging. The problem is that we cannot really hide from the sun, right? We cannot just try to not be exposed to the sun, and it is inevitable that in the end we will get some photodamage. We cannot prevent it completely. But what happens in the cells? How cells change their function when they are exposed to photodamage and to intrinsic aging? So starting with young skin cells, like young children, they can learn various language, right? If I have children, which is young, I can teach them how many language I want, and probably they will perceive it, they will learn, and they will be able to function as a new entity. And this is like young skin cells. They are really functioning, they can learn a lot, they are really sensitive, right? Like children crying from small stuff. Also our skin cells, when they are young, they are really sensitive. They get the signals and they react. They also cooperate together. When we are speaking about young skin cells, they do not compete. They communicate, they cooperate, they work together for the same goal. But when skin cells become older, when skin cells become aged, they started to change their function. They cannot perceive signals as good anymore. They cannot manipulate signals or differentiate or synthesize. They have problem in learning, and sadly, in the end, like us, human, the skin cells stop to communicate. They stop to process signals. And this is called senescence or senescence-associated secretory phenotype. But the question that we need to ask ourselves, how much part or what is the role of extracellular matrix in the role of skin cell senescence? So is it only skins that stop to communicate? Is it only fibroblasts stop to synthesize collagen? Or maybe the extracellular matrix, the microenvironment of the skin cells, is the one that really decides what happened. Maybe the skin cells are doing some function only because of extracellular matrix environment. We know that with age, we see disorganized extracellular matrix, but with age, we also see chronic inflammation, which is inhibited signals, right? Chronic inflammation like macrophage type 1 synthesizing cytokines like interleukin 1 and 6 and TNF-alpha that inhibit cellular synthesis. And this is what we are trying to do in aesthetic medicine. So every one of you, no matter if you're using energy-based device or injectable, you're trying to stimulate, you're trying to take these cells that become old and try to make them behave young again. So you're trying to stimulate them to differentiate, to proliferate, to produce new collagen, to produce new elastin. But this is a major question. Because if you want to create new skin, if you want new skin cells, if you want new synthesis, if you want young cells, you always need to consider that these skin cells are found in an inhibited extracellular matrix environment because of chronic inflammation, because of active oxygen species, because of many inhibitor signals. And then, of course, the extracellular matrix is also full with dysregulation signals. Because what happened with aging, and this is a study that was published 5 years ago, not only amount of collagen decrease, it's not only that the cells cannot synthesize, but all the proteins that are required for regulation of protein synthesis, regulation of collagen layering, they decrease even more dramatically. So the extracellular matrix aging has a major role in microenvironment synthesis or in cellular function. And you can see it according to this study that was published in 2011. It's not a new study, but it shows exactly that. When we are taking stem cells, young stem cells, and we are putting them in old extracellular matrix and young extracellular matrix, look what happened. When you are putting stem cells, really proliferative, they are not senescent at all, and they are in old extracellular matrix, they cannot proliferate. They cannot do anything. So it's not the cells that decide if they will produce and proliferate, it's the extracellular matrix that influence the cells in order to produce, synthesize, and proliferate. Because if you are putting them in young extracellular matrix, they will proliferate. But this is not the shocking thing. This is the shocking thing. When you are taking senescent cell, old cells, not new cells, cells that are already aged, and you put them in old extracellular matrix or young extracellular matrix, the same things happen. So it's not the cell. It's the extracellular matrix that dictate the cells how to function. No matter how much you will stimulate the cells to proliferate, to synthesize, to produce, if the extracellular matrix will be full with inflammatory markers and emptied from nutrients and full with reactive oxygen species, you will not be able to stimulate them. And this is the power of extracellular matrix optimization. This is why every time when I'm trying to regenerate, when I'm trying to influence cellular function, I will always optimize extracellular matrix environment. It's like plants, right? If I want to grow a plant, I will always put fertilizer in the ground in order for it to grow. I cannot hope that it will grow just because it is young and I'm putting effort for it to grow. But this is another concept. When I want that the extracellular matrix will be optimized, I don't want that it will be for a few seconds. I need it to be long-lasting. And this concept, it's like in medicine. In medicine, we have pills, like medication, that we can take and we can have high therapeutic effect. But I want to keep the therapeutic window for a long time. I want long-lasting effect. I don't want 1, 2, 3 days. I want weeks of extracellular matrix optimization, like general medicine. And this is Cell Booster. When I'm speaking about Cell Booster and the CHAC technology, I'm speaking about that. Long-lasting extracellular matrix optimization. And this is true for all indication because there is no one situation that I need extracellular matrix optimization. I always need, and I need it to be long-lasting. So what is the CHAC technology? The CHAC technology allows you to deliver nutrients, antioxidants, vitamins, and everything needed for extracellular matrix optimization for a long time. And the reason is because the HA is very big. It's million kilodalton. And when the HA is big and it incorporates vitamins, amino acids, and antioxidants inside of it, inside the structure, you can get a slow-release, long-lasting effect. And by doing that, you increase the active ingredients and the antioxidant in the tissue for really long time. And then you have long-lasting extracellular matrix optimization. So in the Cell Booster portfolio, we have 4 different products. We have Cell Booster Glow, Cell Booster Lift, Cell Booster Shape, and Cell Booster Hair. And the different layering of injection is according to their indication. We will cover all 4 of them. But Cell Booster Glow is mainly for pigmentation, for treating pigmentation. We'll see later why. But this is why we inject it really superficial. We want that it will be close to the dermal-epidermal junction to the melanocytes. Then Cell Booster Lift should be injected into the dermis. It will affect fibroblast and collagen synthesis. Cell Booster Hair and Shape will be injected deep because Cell Booster Shape affect adipocytes and Cell Booster Hair will affect follicles. So we need to inject them deep. So the depth of injection depends on the indication, and every product has its own indication. So let's start by Cell Booster Lift. Cell Booster Lift is the one that is responsible for extracellular matrix optimization for the fibroblast, and this is why it contains these ingredients. So it has hyaluronic acid, of course, non-cross-linked. All Cell Booster portfolio is non-cross-linked, and this is why it can be injected superficial without being afraid from a long-lasting edema or some papules or long-lasting papules like with other HA product. It will contain vitamins for antioxidant function and for cofactors in collagen synthesis like vitamin C, vitamin E, and B2, and of course amino acid, both essential and non-essential for production of collagen, because all of these amino acids are important, either to incorporate into the collagen or as cofactor in collagen synthesis. So HA. Why we need HA in the Cell Booster Lift? If we want to optimize fibroblast extracellular matrix, why we need HA? And the reason is because HA create mechanical stretching. So we inject HA into the dermis, it will stretch the dermis and thereby stimulate intrinsic factors inside fibroblasts, integrin receptors that are connected to collagen to synthesize more collagen. But HA is doing more than just stretching. HA is connected into receptors on fibroblasts and stimulate their function. So we see CD44 receptor, and when HA is connected to this receptor, we see stimulation of collagen synthesis. Amino acids. So there are some amino acids like arginine, which are important cofactor in collagen synthesis. Without arginine in our system, without arginine in extracellular matrix, the fibroblast will not be able to produce any collagen. But it's not only arginine, also glycine and proline, which are, yes, incorporated into collagen, but they are also a rate-limiting step and dependent step in collagen synthesis. So it gates collagen synthesis, and if I increase their availability, the fibroblast will be able to produce collagen easier. Again, extracellular matrix optimization, extracellular matrix functioning in order to make the cells produce better. Of course, antioxidants are important in collagen synthesis process and in regeneration, because with higher reactive oxygen species amount, the lower ability of cells to produce and to synthesize. And this is why we can take the Cell Booster Lift and change skin texture, wrinkles everywhere in the eyes, pores. No matter what you are working on, you will be able to improve the texture of the skin, because the skin cells will produce better, and this is only with standalone. In the next part of my speak, after my colleagues, we will discuss the combination of energy-based device, which even amplify the result more. So let's discuss Cell Booster Glow. Cell Booster Glow is for pigmentation. It's not for collagen synthesis alone, but it can also create or stimulate collagen synthesis. You will see later why. But Cell Booster Glow have 2 important ingredients that Cell Booster Lift does not have. And these are cysteine and glutathione. Cysteine is important cofactor in melanin synthesis, but also glutathione. And I want to show you both of these parts. So speaking about glutathione, glutathione is very important product in antioxidant function. So it is a powerful antioxidant, decrease reactive oxygen species, but more than that, glutathione gates cysteine insertion into the cells or integration into the cell. And when cysteine found inside the melanosome, it gates melanin to be synthesized as a pheomelanin and not eomelanin. And this is important because eomelanin is darker pigment than pheomelanin. And the ratio between eomelanin to pheomelanin also change with time and creating darker pigment, especially in dermal pigmentation like melasma. So gating cysteine into the cells and cysteine gating synthesis of melanosomes into pheomelanin has important role in dermal pigmentation, but it will be covered later in further details. Cell booster shape. So cell booster shape does not control not the melanocytes, it's not for melanin, this is glow, not the fibroblast, this is lift. Cell booster shape is for adipocyte. Because it also contains two ingredients, and look there, it does not contain all amino acids and antioxidants like the cell booster glow and lift. It has the vitamin C and L-carnitine, which are two important process factors or factors that involved in process of adipocytes. When adipocytes age, when adipocytes become older, they do not behave like fibroblasts. They do not stop to synthesize. When adipocytes age, they become bigger. They become hypertrophic. And the reason is because they accumulate fatty acid because they cannot use them for energy synthesis. And this is why when we are looking on aging and we want to reverse adipocyte aging and optimize the extracellular matrix for adipocytes, what we want is to stimulate lipolysis, but not destroying the fat, not creating apoptosis of fat cells, but stimulate their metabolism, stimulate the mitochondria, stimulate the genetic expression of lipolysis that were lost with time. And L-carnitine is a great factor to do it. Vitamin C is adding even more metabolism because it stimulates mitochondrial function and decrease accumulation of hypertrophic adipocytes. And this is why the combination of L-carnitine and vitamin C optimize extracellular matrix environment for adipocyte. And lastly, cell booster hair. Cell booster hair is a product for follicles. But cell booster hair contain amino acids and vitamins, also trace elements like zinc and copper that are important for hair growth. Because if we are thinking about anagen and telogen cycle of hair growth, we understand that there are some elements that are important for this cycle to go into more of a growing stage. And zinc inhibit androgen effect on WNT pathway, but also vitamins, arginine, copper, increasing telogen to anagen's change and thereby stimulate hair growth. So my take-home message from the presentation of Cell Booster is very simple. With age, we decrease our ability to synthesize, to proliferate because of senescence. This is true. But the extracellular matrix that is inhibited and dysregulated affect the cells not less than the aging itself. By optimizing extracellular matrix, you can amplify everything and every process that happens in the cell. If you want to amplify fibroblasts and make them produce more, no matter what you're doing in your clinic, optimizing with Cell Booster lift is mandatory for me. If you want to optimize pigmentation synthesis with dermal pigmentation, I will use Cell Booster Glow. If I want to optimize cell of adipocytes, if I want that the adipocyte will function better, I will use Cell Booster Shape. And if I want the cell hair, the follicles to grow, I will use Cell Booster Hair. But I will always optimize extracellular matrix for better function. So thank you for listening, and we will continue with my colleagues.
So thank you, Alexis, and also thank you, Dr. Guy, my friends, to dive into the detail of CHAC technology and also the active ingredient, each other type of their cell booster. So in my topic is about the cell booster shape. This is so surprising to me that something that we didn't think it before that it can manipulate the fat, especially the vitamin C. So in 20 minutes, I have just only 20 minutes from now. I'm going to talk about the regenerative protocol for fat pad management in deformation, aging, and contour change. So just remember about the words of deformation. I will be explain about these things. So here is my disclosure. Thank you, SUISSELLE, for support the product and also the gathering the conference like this before. And this is my disclosure. I'm a dermatologist from Thailand. I have an experience in the aesthetic field. It's around 20 years. And now today I'm a country mentor trainer for Gain or Galderma aesthetic and also covering the energy-based device and also the thread lifting. So here, first of all, we need to understand about the fat pad on our face. So actually, the distribution of the fat in our face is predominant of white adipose tissue. So brown adipose tissue is just minimal or absent in adults. So we talk about the white adipose tissue when we think about the manipulation of the facial fat pad. So the structure, the duty of the dermal white adipose tissue is not just only to fulfill the layer, but it's also entirely to create the structure of our face too. So the previous concept of the manipulating the fat, we focusing on the lysis, we destroy it. So after that, we have the problem, especially for the sagging and also the laxity of the skin. So that's why I bring you to the new concept. And another duty of dermal white adipose tissue is about the energy storage for cells. So here is the table that comparing to two types of the fat pad, the white adipose tissue and also the brown adipose tissue. So I just highlight you on the bottom of the message this L-carnitine support fat utilization rather than directly burning fat, leading to improved metabolic health. And here is the action of the L-carnitine that I mentioned before. It promotes lipolysis and browning and reduce fat mass. So here, you need to understand these things. So when we talk about the facial layer, most of the doctors forget about the deep fat layer structure. So duty of the deep fat is essential to support the structure. We forget this thing. So sometimes we destroy it. So then after that, we got a disaster that we have the sagginess of the face. So that's why I emphasize that you need to keep the deep fat layer. And this is the deformational aging of our fat. So it's not just only one dimension that we think about the volume loss, but it's more than that. So here is the aging of the fat. So it atrophy, it descends. The quality is also decline, and compartment is breakdown. So that's why the previous lipolytic solution got the problem, because it destroys everything. It breaks down the characteristics of the fat pad there. And also the vascular and collagen will be lost. So that's why the vial of the cell booster shape content is not just only for the lipolysis, but it also has something that improves the skin quality, improve the microcirculation there. So here, when we age, so everything's going down. So gravity is the major problem. The gravity is the major factor that got descending of the fat pad. So some fat pad, deep fat pad gonna be deflation by atrophy, and after that we have the redistribution of the fat going deep down, descending down. So some area we're gonna have the accumulation of the fat pad more, like in the nasolabial fold, for the jaw area, especially for the lower face area. So here is the characteristic that's gonna be changed. So this guy, when he was young, he was very handsome, right? So that's why he married with the model. But I don't think so. I think it's just only about the money that he got, right? So here is the aging characteristics that's gonna be changed. And about the neck, so we play a role for the superficial subcutaneous layer. We can divide the neck around the fat pad around the neck as a pre-platysmal fat pad and post-platysmal fat pad. We just manipulate the pre-platysmal fat pad there. And it is being noted that the post-platysmal fat pad is not the target for intralipotherapy. If you go deep down, then the superficial cervical fascia, you're going to have the problem. Because the middle cervical fascia and deep cervical fascia contain the very vital organ there, the vascular and the nerve. So need to be careful that we just play low for the superficial cervical fascia fat pad there. And in obese, the extra fat that is deposits and show the characteristic of double chin is the superficial fat pad in the superficial cervical fascia. No need to destroy the deep fat. No need to take the risk there. And this is when I face with the patient, we need the picture to show them the before picture. What is the severity of your next area? So if you don't have the picture, you cannot demonstrate before and after good enough. So here is the example, the man and the girl there. You can grading, you can see, make a severity of your patient. And the previous, they have the paper that confirmed that the mesotherapy and injection lipolysis got a disaster, the fat destruction. So we try to aggressive lipolysis. So every time that we aggressive lipolysis, we break down the septal tube. We create the sagginess of the skin. So it's gonna be have the skin laxity, irregular surface, the fat necrosis and inflammation, and also the scar and fibrosis development. So this is the problem. And here is another complication that is very serious from the inflammatory process after you inject the lipolytic drug. So that's why not anymore for the lipolytic drug for me in my practice. This is a comparison with other injectable fat reducing agent. So L-carnitine is totally different from the previous, like the oxycholic acid and phosphatidylcholine. So for the oxycholate and PC, it's gonna destroy the fat. It's destroy everything. It create moderate to high inflammation. But L-carnitine is totally changed. It's not directly destroyed to the fat. It enhances beta oxidation to let the cell use the fat storage. So bring the free fatty acid to the cell to deliver, to create the energy. And after that, the better thing gonna become. So here is the concept that is totally different among the fat-reducing agent. And now today, the paradigm is shift. Thank you, Dr. Guy, for talk about the ECM. So now, I think that this is the decade of the ECM. So every procedure in aesthetic field talk about the ECM. So it's not just only for keep the structure, but it also how can we boost the cell? How can we make a nice environment to have a new things that coming back again. So from the previous fat destruction, it's caused the skin laxity and contour irregularity that I mentioned before. The thing just about the only one dimension of the fat, just lessing the fat, lose the fat. But now today we call it precision modulation. It's selective fat pad remodeling and preserve structure architecture because we didn't break down the septal. And after that, we create the regeneration of the mole and connective tone, low inflammation, faster recovery. We think about multidimensional, the right fat into the right place with the right and skin, better environment there. So here is the protocol and clinical consideration. So ideal candidate is mild to moderate localizing fat pad deformation. So if your patient obese, maybe you can combine with another procedure to show the impressive results. So maybe you use with the miracle pens, that is a trend for today. But in the patient that use the miracle pens, they're gonna have the skin laxity every time. That's why, like we are in the Galderma company that creating about the protocol for treating medical-driven weight loss. So that's why this is the new paradigm shift. And the consideration, you need to select the proper patient. You need to mapping the anatomical, realistic expectation. The first thing that you're gonna be success in aesthetic field is not that you have a good hand enough. It's not like you have a best procedure. But the first thing is also take a conversation, set the realistic expectation to your patient. This is the first thing in my practice. And after that, we have the evidence in progress. We can measure how they change. This is a cell booster shape. Thank you, Dr. Guy, for talking deep dive into the active ingredient. But just remind you that the active ingredient is L-carnitine and also the vitamin C, and composition by the hyaluronic acid non-crossing 18 milligram. So here is the Chuck technology. So you mentioned it, thank you. And this is the things that I just cracked to you. For HA, it has the benefit of hydration and structure, have the property of anti-inflammation, longer duration, high lifting capacity, and also immediate plump the skin, but not for a long time. So don't worry about the overfill that you're going to be inject with the cell booster shape. But we can deliver the lifting effect I'm going to show you. And another that is very important in this while is L-carnitine. It's a cofactor for long-chain fatty acids across the mitochondrial membrane. Equilibrium the glucose fatty acid metabolism, lipid breakdown, and increase energy expenditure. So the cell will have more energy to repairing, to regenerate, to do everything that you want to deliver. And with HA, it will be prolonged bioavailability. That's why. Here, an implication of L-carnitine in aesthetic medicine. You can apply it to body contouring, to manage the cellulite, and to make a skin longevity. I'm going to be present what is the benefit of L-carnitine for dermal layer here. And you can enhance lymphangiogenesis, so decrease the swelling, participate in cell volume, fluid balance in all tissue, lymphatic absorption of the fat, and you can use it as anti-edema and also antioxidant and anti-inflammatory property there. Here is the histology that proves that L-carnitine preserve adipocyte integrity. It does not trigger inflammation or necrosis after you inject the L-carnitine. So we have the evidence that you can tell your patient. And safety evidence. So it's just only a minor complication like transient erythema, edema, mild discomfort, rare bruisings, but need to be in the good hand too. So you need to mapping anatomy, the danger zone I will be present. No significant nerve injury or vascular compromise after you inject the L-carnitine. So here is the benefit of L-carnitine for intradermal layer. Enhancement of the cellular energy metabolism, like I mentioned before. They can have energy more to repairing, to regenerative. Antioxidant and anti-aging effect. Stimulation of fibroblast activity and collagen synthesis. Improvement of microcirculation and lymphatic drainage to reduce edema and anti-inflammatory action. So for skin aesthetic application, we can use it as a skin rejuvenation, periorbital treatment, even the darkness of the under eyes area, cellulite and skin laxity. And you can use this by combination with HA, with skin booster, with PN, or energy-based device. We will be discussed and we will be listening to Dr. Guy protocol. And this is the comparison versus intradermal and subcutaneous use for L-carnitine. You can capture it. We have benefit board, but just a little bit different that if you inject into the subcutaneous layer, you can modulation the fat by let cell to use the fat storage there. And here is the systemic combination that we're going to be listening later of L-carnitine from with other procedure. We can combine combination, like I mentioned before, to create hydration, to create the tissue regeneration, enhance skin vitality, and improve collagen remodeling. How about the dermal white adipose tissue in our skin? It's very important for structure, like I mentioned before. It creates structure. So risk of dermal white adipose tissue destruction is going to be have the skin laxity, thinning of the skin, contour irregularity. That's why the previous lipolytic that create the irregular surface after you inject it too much. And fibrosis on nodularity, potential impairment of regenerative capacity because of inflammatory process there. And this is the mechanism of L-carnitine, why it does not destroy dermal white adipose tissue. Because this is a new concept, they just enhance the metabolic, not a cytotoxicity. Absence of adipocytolytic activity as proof in histology that I mentioned the paper before. So here we change from fat destruction to precision modulation. So the new concept of fat modulation is precision modulation. And another that is surprising me about the active ingredient is vitamin C. So we learn a lot the brightening effect, the whitening effect, antioxidant property, promoting the new collagen. But nowadays, we found that vitamin C can protect against adiposity and inhibit the adipocyte differentiation. This is for a long-term result. So even you have like a gain weight, but not a lot. So you can prevent to differentiation from the adipocyte if you inject the vitamin C. So this is the new things. And this is another property of vitamin C is increased collagen, increased carnitine about the metabolic energy, increased catecholamine, amidated peptide, decrease DNA methylation as antioxidant property, and decrease the hypoxia inducible factor. So this is the things. And so many papers that confirm about benefit of the vitamin C. You can search it, you can capture it, and read it after this. So here is a synergic quartet. So we have the high molecular weight HA to hydrate. And after that, we have L-carnitine to mobilize the fat, to bring this fat cell, the free fatty acid chain, to use for creating the energy. We use it more. We protect it, we prevent it, we maintain it because we have a vitamin C that inhibit the differentiation of the adipocyte. And also, the things can be occur because of the chuck technology. This is a patent chuck technology. So here is the picture that conclude about the when we synergistic action of high molecular weight HA with carnitine and also vitamin C, we can decreasing the fat, we can improving the next area, and also the very difficult area to treat, edema of under eyes area, the eye bags. It's really surprising me that it's really good product for this area. You need to mapping anatomy like I mentioned before. For the lower face, you need to be careful the marginal mandibular nerve, the artery and vein, and also the parotid region, the parotid gland. So the depth of injection is really important. So be careful about this thing. General contraindication for users: pregnancy, lactation, active inflammation, infection, no hypersensitivity to the L-carnitine, and severe systemic metabolic disorder. And here is the area of the mouth man. So you draw the mandible line, and below that 1 to 1.5 centimeter, this is the no growth zone here. So need to be careful. And the center at the thyroid gland, you need to be avoid that. So shape program, intensive course, we recommend that 3 treatment, 2 to 3 weeks interval. And after that, 1 treatment per month to maintain and to make a wonderful result, the perfect result. We have the full-fledged approach like this. We can inject it, just inject intradermally, subcutaneously. You can have this protocol. And this is the example that you can use the blunt cannula too, to inject with the less entry point area. It's not difficult, it's very easy. For localized submental fat volume, we need the bolus technique, around 4 to 6 millimeter injection perpendicular to the plane and right down to the superficial subcutaneous layer. And here is my case. So superficial fat pad, actually we cannot discrete or we cannot distinguish it as the fat that has a ligament to divide it. But we can also see some fat pad like nasolabial fat pad and jowling. So that is the target area. So most of the target that we target is about the area that have the effect from the gravity, the lower face area. And I mark the mandible line and also avoid the area of danger zone. So here, and injection per point is around 0.2 to 0.3. But some area, I try to inject 0.4, no complication, no redness, no swelling. You're going to be surprising immediately effect that I'm going to show you. So here, this patient didn't apply the topical anesthesia, didn't apply the topical anesthesia. This is no painful. So here, before and after, immediately lifting. So if you have a good mapping, you can create this one too, because we have the high molecular weight non-cross-linked HA that bring the tissue lifting up immediately. And after that, I'm going to be inject another one. And here is before and after, just only one session. So clearly, obviously, change of the lower face and also the next area. So the quarter view is more clear about the submental area and lower cheeks area, the jowl area. And here is the 90-degree. Obviously, change. Another side here. And how about the second session? When we measure it by quantifier. You're going to be seeing the blue area that is decreasing the volume of the fat. So it's very impressive. It's just only 2 weeks after that here. And here, when you draw the reference line, you're going to be see the after is behind the line. So this is the thing that you can prove to your patient here. And this is the second session. So after I did it every 2 weeks. So it's gonna be changed more. So you see, this is post-second section. It's really big change in my patient. So this is my staff, and I can control that they're gonna do just only this procedure. So here, it's really impressive me. So in conclusion, okay. Okay, so that screen is more clear. It's okay. So something have a technical problem. Okay, but it's obviously changed. So in conclusion, we precision modulation the fat, and we can create increasing the lymphatic drainage and improve skin quality. So this is my last slide. So if you're making bomb, it will only destroy us. It doesn't matter whether we use them or not. They will destroy us either way. So think about the new thing the new concept that I bring to you, to precision modulation of the fat. Thank you so much. So happy that you are in the game.
Okay, good morning, everyone. Today, my topic is regenerative support for skin quality. We talk about the patient selection protocol and the real-world outcome. And I am Dr. Chanat Ratanawani, aesthetics physician from Thailand. Oh, sorry. And this is my profile. I work in aesthetic field for 16 years old, and now I'm speak for many brands and EBD, and now I'm a KOL of the Merz Aesthetic also. And this is my disclaimer. Okay, which Mona Lisa would Leonardo choose today? Probably not the one in the middle. Because beauty has never been about excess. Beauty has always been about harmony. That is exactly why regenerative aesthetic is becoming the future of our field. Today, I would like to share how regenerative support can improve skin quality, not by changing the patient identity, but by restoring the biology beneath the skin. Today, instead of discussing how to add more volume, I would like to focus on something even more important: how we can regenerate skin quality from within. In the past, we focused on the correction to the treatment focused on dynamic line and superficial fold. And next, we moved to volumizing by filler from 3D structural restoration and facial contouring. And nowadays, we move to stimulation, mechanical and thermal injury to trigger remodeling like a biostimulator. And now we move to regeneration by physiologic geoprotection, support healthy ECM and cellular function. This picture shows from development from collections, overfill, and then regeneration. In the past, the aging stimulates process extending beyond a volume loss. The structural filler may lead to unnatural control and tissue fatigues, but in the future, Modern patients prioritize healthy, vibrant tissue and natural light reflection. This one is the young cell and the aging cell. We see the ECM degradation by UV-induced upregulation of MMP. So we can see the elastin breakdown and HA fragments, high molecular weight HA degradation into a pro-inflammatory, low molecular weight fragments, and fibroblast dehiscence is reduced cellular function, deplete structural biopolymer, and also that we talk today, biochemical deficit, depletion of the cofactor vitamin C, amino acids, and impair proper collagen cross-link. HA is a biological signaling molecule. High molecular weight HA, 3,000 kilodalton, provide a structural integrity and hydration. And HA acts as a vital ligand of the CD44 receptor on the dermal fibroblast and keratinocyte. CD44 receptor is a multifunctional transmembrane that acts as the main cell surface receptor of HA. The modulates of the microenvironments to support physiologic ECM renewal. And physiologic collagenesis is a controlled tissue maintenance and require healthy fibroblasts and vital nutrients and organize collagen deposition and result in natural and a good texture. But fibrosis is a pathologic repair response driven by chronic injury, and excessive collagen deposition result in tissue stiffness and irregular texture. The clinical goal that we focus to support biologic condition rather than cement the tissue. And today we talk about the cell booster growth. The cell booster growth have a hyaluronic acid, is non-cross-linked high molecular weight, 18 milligram per 3 ml, so it means 6 milligram per 1 ml. And amino acids like cysteine, glycine, lysine, proline, and valine. But it's different from the cell booster lip that have cysteine and glycine and glutathione have in the cell booster growth, and have a vitamin C, biotin, and also glutathione. Cell booster growth use the check technology that Dr. Guy and Dr. Fuchs also tell. The free components of micronutrient and HA is used is press and shear deformation to complex to a stabilized complex without without chemical cross-link agent like a BDDE. It makes it shield HA from the rapid enzyme degradation by hyaluronase. In the picture is this picture is a simple cocktail, the free nutrient and HA attached to the CD44, but it's limited cellular uptake. But when when in the link complex, like check complex, it can attach to CD44, and then endocytolysis. It make long-lasting biochemical support to a fibroblast. The therapeutic potential of cysteine in the cell booster growth play a role in melanin control. Melanin control by reduction of the total melanin and activate pheomelanin pathway, and also in the collagen metabolism, wound healing, and antioxidant effect and anti-inflammatory effect. The cysteine have play a role in increased glutathione and decrease in the ROS. As the therapeutic potential of cysteine that activating of the pheomelanin pathway of the reduction of the total melanin, the skin color is detected by precious ratio and absolute amount of these two fundamental difference of pigment output. The eumelanin dominant in the darker skin and pheomelanin dominant in the lighter skin and red hair. Glutathione and cysteine play the role in change the dopaquinone and shift the pathway of melanin to the pheomelanin, increase pheomelanin. And the result is a reversible switch from the creating brownish black eumelanin to reddish yellow pheomelanin. And here is a paper use cell booster grow by use skin segments separate into group, control and treat group. The treat group was injected by cell booster grow and both groups were irradiated by UVA and UVB and follow up in 12 days after. From the white clinical evidence, see the significant reduction in the skin cell with high melanin content. The pigment effect decreased in 16%. And the control and the treat size, we can see the overall skin condition improve, improve in massive upregulation of the collagen type 1 and significant restoration of the functional elastin and enhanced sulfate GAG that you can see in the right side, the histologic proof of efficacy. So move to how to patient selection. Optimize patient selection to use cell booster grow. The first is early to moderate aging. The patient that exhibition early elastosis and structural fatigue, or someone who the preventive protocol like a younger patient seeking a sustained skin healthy over the volumized, or patient have a photo damaged skin with downed uneven texture, or post-inflammatory states, like the patient require ECM support to recovery from the instinct or extinct stress. And the clinical indication, we can use the booster grow in the face and neck to comprehensive revitalize, improve hydration and fine line, and also decollete to reverse UV-induced texture change and hyperpigmentation, and also in the dorsum of hand to restore dermal thickness and pigmentation. And also in periorbital region to gentle ECM support for delicate thin tissue without heavy volumization. The safety profile and contraindication, as we know, active infection and severe inflammatory in the treatment area and known as hypersensitivity to hyaluronic or the complex components. And autoimmune disease, but it's a relative contraindication, and also in the pregnant and lactation. The standard treatment protocol, if the intensive phase, I suggest 3 sessions 2 to 3 weeks apart, and maintenance phase 1 session every 2 to 6 months. If consolidation phase, optional is a 4 sessions in the first at the 1 month for the severe photo damage. At the one time, use 1 bottle is 3 ml. Injection technique, due to we want to inject focus on the melanin, so we have to inject and mid to deep dermis, direct interact with the fibroblast population. Use micropapule technique to 0.02 to 0.01 ml per point, space 1 to 2 cm apart. You can inject in the forehead and around all over the face, but it inject intradermal deep. I use 30 needle, 30G to 32G needle. And this is the video that I inject, but in this video I inject 30 Tg. Yes, due to we have not much time, I will go fast. Okay. synergic combination in the practice, we can use Salbutamol as a biochemical support with the energy-based device or stimulation and structural correction. Can use to precondition as a to prime ECM with nutrient period to aggressive EBD, or during treatment by induce remodeling and modulate inflammation, and post-treatment recovery to repair and minimize fibrotic healing, and also in use with the toxin and filler. And we move to the real world outcome. This is my patient, female, 36 years old. The result is 1 week after one session. Okay, 1 week after one session, you can see the overall result. You can see the skin is brightness and reduce in fine line. But I only have this picture. I only have take only 1 week apart. So the result is not much improved. But I can see the brightness of the skin. And this one from the skin analyzer, you can see there's UVB pigment, brown area, and UV moisture, and pore improve every skin condition. And the next case, female, 46 years old, also 1 week and after one session. Visible improvement in the global luminosity and reduction of the static fine line, and highly natural morphologic result. This one, you can see the improve of the skin texture. Okay, and the skin from the skin analyzer system, UV pigmentation and brown area improve, and UV moisture and pore also improve. From another case, you can see the fading of melasma and improve in global luminosity and reduction of static fine line. This one also fading of melasma and improve in hyperpigmentation. Fading of melasma and skin texture is improved. Improve in hyperpigmentation, and this case also hyperpigmentation is improved, and you can see the fine line improve in fine line. Lentigine and hyperpigmentation and fading in melasma, and this one also, and elastosis is improved, a fine line allow mouth improve, and fading of melasma, and this picture is very clear, improve in static fine line. And the clinical pearl for aesthetic precision is first you have to manage expectation. When we plan the ECM, maybe the result is not immediately the result. So you have to manage the expectation of the patient and respect the dermis, avoid deep hypodermis injection which wastes the active ingredients, and holistic assessment combined with the longevity medicine for maximum result. Prevent fibrosis, used to calm tissue in the patient with sensory to overstimulation. Take-home message is modern aesthetic practice is moving towards healthy aging and physiologic repair. True collagen stimulation require biochemical support, not just a mechanical injury. And check technology enable target CD44 mediated delivery to stabilize nutrient. The future of aesthetic medicine is regenerative, physiologic, and patient-centered. Thank you.
Thank you.
หลุด
Yeah.
เกิน
Not for Q&A, this one. Okay, so thank you, Dr. Fruit and Dr. Jenny. You did a wonderful job. We have something in common. So they upload it here, probably. You did a wonderful job. We have something in common. We both see both the paradigm shift in aesthetic medicine into regenerative, and we both see the scientific part, which is very important, because when we are speaking about the future of aesthetic medicine, of course, we need to dive into science, and we are sure that most of you have energy-based device, and you will combine Cell Booster with energy-based device, and this is why I will use just a few next minutes to dive into that, and we'll leave you time for questions. So, energy-based device. Let's start with the perception of rejuvenation. Because we are doing rejuvenation with various devices. We are using both superficial, lasers, RF, deep, HIFU, and monopolar RF, and we're using them to rejuvenate the tissue, to make it young again. My protocol for rejuvenation will always be multi-layer and will always be combined with extracellular matrix optimization. So I will start with deep energy-based device, will address the biostimulators, and then I would progress into Cell Booster for microenvironment optimization. So for using or for getting tightening, lifting, and improving skin quality, again, HIFU or monopolar RF, follow with biostimulator injection. This is an injection of Sculptra, and then injection of Cell Booster Lift. And the reason that I will inject Cell Booster Lift is because I want to rejuvenate. When I'm speaking about acne scars, yes, subcision is mandatory. I will always make subcision. But when I perform some subcision, I will use, again, a product that optimizes extracellular matrix environment. So I will create a top local anesthesia with lidocaine everywhere, and then I will do subcision from 2 directions, and I will use for the subcision Cell Booster Lift, because for me it's not enough to cut the septors. I also want to improve extracellular matrix optimization in order to get better response. And if I do subcision right, with the right product, with extracellular matrix optimization, followed with laser or with topical growth factor, we can get wonderful result. Similarly speaking about stria distensis, so I will start with the injection of Cell Booster Lift in order to optimize extracellular matrix environment. It will be followed with some energy-based device and topical delivery of PDRN, exosomes, biosomes, because I want to create a good extracellular matrix environment. What about pigmentation? So for pigmentation, again, I will use various modalities. When I'm treating melasma, yes, I will use my laser. I will use a Q-switch laser. I will use 585 nanometer Q-switch. I will use non-ablative fractional laser. I will use thulium laser for resurfacing and delivery of topical product. All of that. I will use tranexamic acid. But in the whole pool of combining energy-based device with topicals and with injectables, extracellular matrix optimization with antioxidant like glutathione and cysteine are mandatory. So I will start with Q-switch laser 1064 nanometer to dissolve the deep pigment, followed by non-ablative fractional laser to remodel dermal epidermal junction, then topical, and then injection of Cell Booster Glow. And this is for, again, optimizing extracellular matrix environment and getting better response. And thereby, I improve pigmentation in all layers. And when I speak about deep dermal pigmentation, no matter if it's on the cheek, around the eye, around the perioral area, after post-inflammatory hyperpigmentation, in darker skin phototype, this is what we have in common. Our skin behave similarly. What about fat remodeling? Dr. Fruit presented before me the changes that occur in the fat tissue and why it's so important to treat them. So yes, I use deep energy-based device. I will use HIFU monopolar RF to stimulate mitochondrial response, to create some mild lipolytic effect, but I will always combine it with Cell Booster shape. And because L-carnitine together with the HIFU will stimulate that better. So we did a case study presenting both with ultrasound and with live vis response of changes of fat volume before and 1 month after. And we also used the Cell Booster shape with HIFU or with monopolar RF, injecting with cannule into the eye bags or into the area of edema retention in the malar area, into the fat pad directly with ultrasound in order to see the difference. And this is what we saw with ultrasound. We saw changes not only on thickness, but also of texture. So decrease edema, decrease fat, and this was consistent with many cases. Again, changing not only the thickness of fat, but the behavior of fat. No edema, no hypertrophy of fat pad. And again, it was proved not only with ultrasound, not only with clinical, but also with live vis in order to see the changes of the volume and the location of changes of the volume. For hair regrowth, we will combine PRP. I like PRP. I will not take my PRP out only because I have cell booster hair. Opposite, I think that the combination, the synergistic effect of growth factor together with extracellular matrix optimization create a wonderful result. So I will inject PRP, I will inject cell booster, and I will do it together in the same session. I will get wonderful result, both improvement of the amount of hair, thickness of hair, color of hair, and the amount of follicles that will be proliferate because of extracellular matrix optimization. So combining cell booster with energy-based device and with injectables, for me, it's my favorite. I will always make this combination because for me, cell booster will optimize my extracellular matrix environment and thereby amplify every response that I'm trying to make. No matter what indication, what I'm doing in my clinic, it doesn't matter. Everyone deserves extracellular matrix optimization. So thank you for listening. And now, if you have any questions to the speakers, thank you. Questions?
So do you have any questions? Because I have a couple of questions.
Okay.
Yeah, for the doctors. I mean, thank you very much. I mean, I was also impressed. I mean, every time when I'm seeing these clinical cases, and I think it's very comprehensive, and from my view, it's very scientific based, and it's very practical. And also, you're not showing just the usage of the product, but you're using very interesting technique and the patient approach, how to manage the patients, and also putting some ethical questions as well, how to deal with the patients, deal with the expectation. Thank you so much. It was very helpful. Dr. Guy, for you, maybe if you can repeat, I mean, as a conclusion, what's your rationale, clinical rationale, to combine cell boosters with a energy-based device? What's your clinical rationale?
So the rationale for me, I love energy-based device. For me, this is my main topic. I did my master degree on energy-based device. I'm doing research on skin cancer with prevention with lasers. I love energy-based device, and nothing will take my energy-based device out of my clinic. But the problem with the energy-based device, that they create some controlled damage. I want the controlled damage, but after the damage, I expect some regeneration. And for optimizing regeneration, for getting better regeneration, we saw earlier the research on stem cells and senescent cells, I must change extracellular matrix. Otherwise, I will have response, but they will be milder. So this is why I always combine cell booster with energy-based device.
Yeah, thank you so much. And I mean, this slide was very, I would say, visually confirming how the environment can change the activity and overall the synergy for better performance. Dr. Fruit, and for you, the question, how do you select the patient for the slim phase protocols?
Okay. First of all, like I mentioned before, the first thing that I talk to the patient is about the reality. So if you have a mild to moderate sagging, you can do a non-surgical procedure. And nowadays we have so many procedures, but why cell booster shape? So it's about the evidence base and also the clinical base. So these things gonna bring you to success, because nowadays my position in my practice, so most of my patients is about the moderate high to high position. So everyone know about the data. So you can search it, you can Google it, you can ChatGPT or something like that. But dive into this, if you know the paper, know the study, your product have the study to confirm them. This is the easy way to do that. So for cell booster shape, mild to moderate sagging, mild to moderate like over excess of the fat, not too much. Because it's too much, you cannot present the immediate or wow result to them. So nowadays is the case of the time flight. Fastest, how can you do immediately result to your patient? So that is my practice guide to do that. My to moderate sagging, not to over expression, not to overfill of the fat. That thing.
I have to stress, and I totally agree. I think, Dr. Fruit, that what you are saying is very, very important. Realistic expectation.
Yeah.
Because we are speaking now on extracellular matrix environment optimization. It's not a lipolytic effect with cell booster shape. I do not expect to take a big volume of fat and destroy it completely. I expect optimization. And even if I combine it with energy-based device and I'm combining with IFO and monopolar F, I still choose this patient, mild to moderate, never moderate to severe.
Yes.
They deserve surgery.
Yeah, that is the things. And the key success, another one from this product is not to create information. So that's why you can combine everything in the same session.
True. Thank you. And we have one more question.
Okay, I have a question. I'm from Indonesia. Do you have any clinical case that we can combine all the cell booster in the same phase, in the same session, and then which layer do you want to prefer? And then what is the sequence? Do you use the shape first, or the leaf first, or with the glow first? Can you have explain?
Okay, starting from me, from my perspective view. So you just select which area, which indication that you can show wow result first to your patient. That is gonna be determine your first procedure. So if it's me, I just start from the cell booster shape, because like in my presentation, you're gonna be see the immediate result. And this is direct way and immediately way to show them. But for the other SKU of the product, you need to wait. It's just like 1 week, 2 weeks, or 4 weeks from the mechanism of action of the drug and also pathophysiology of our face. So that is my key. So for the same session, in the cell booster shape, for the cell booster shape, I can use it with HA filler, with energy-based device, and also with the laser too. It's not create more information. So that is the key. So if you create too much information, the procedure that this one is in frame, this one is in frame, this one is in frame, the patient gonna be suffer. The first one, swelling a lot. The second one, downtime is increasing. And you didn't know which one can show the benefit. So this is another point that if you mix together but not show immediately each procedure, the patient will be confused which one is show the benefit. So why I need to pay a lot for every? But if each procedure can show the immediately, like we continue, we do it cell booster shape with the high full, we can show it decreasing of the fat by lifting. So that is the example. And how about you, Jen?
Actually, I think it depends on the patient problem, because some patients don't concern about fat, so maybe not use the cell booster shape. But for the cell booster lift and cell booster grow, from my perspective view, I can combine in the same session. Cell booster lift a little bit deeper, but cell booster grow a little deeper in the epidermis. So can inject together, but you can have to tell the patient that expectation of the patient, because if the inject more, the patients are quite want to see the much result. So have to say first that this one to palm ECM. So to palm ECM, the result maybe is not immediate result, right? A filler.
Thank you so much. I mean, we have just 1 minute maybe for the last question, if anybody want to ask. Yeah, please.
Question. I'm from Canada. I've never heard cell booster before. So this is pretty amazing.
Yeah.
So you guys take 3 active ingredients. So it's vitamin C, L-carnitine. Is it?
Yes.
Yes, our candidate.
Yeah.
So the 3 together would combine collagen elastin, stimulation, fat.
You are describing cell booster shape,
Yes.
and cell booster shape is for adipocytes. So L-carnitine will stimulate fatty acid transfer into the mitochondrial metabolism, and vitamin C will stimulate mitochondrial response, and thereby decreasing amount of fat and hypertrophy. The lift one is have another ingredient. Yeah. It's something different. Yeah.
Thank you so much. And what I can propose, we have a booth on the exhibition, and we have also our lecturer guests that can present at the booth. So please come. If you have very direct questions, if you have questions about the product, if you have questions about the clinical cases, please come to us. And let me, from the company, say thank you so much for your impressive cases, for your impressive clinical professionalism, and what you shared for us, because it's a very valid. Me, I have a medical degree. I understanding how it's important to give this information for the doctors to establish great communication with the patients and to serve the patients. Thank you so much.
Thank
you.
And let's say thanks for the speakers. And thank you so much for coming for our event. It was perfect. Thank you so much.
Thank you.
Thank you so much ขอบคุณครับ
ขอบคุณครับ